So the person is having what he's having sensitive tooth he has. Okay, so you can see that in the radiograph you can see some enamel portions is within the tooth. Okay, you can see this, look carefully in this, you can see that there is a enamel portion infolding into the tooth. So there is infolding on, hence we can see that this is dens invaginatus. Okay, so from this picture itself it is very clear, the answer is dens invaginatus. If it is exaginatus, it is coming out. Okay, it's not enamel pearl, it is not talent scabs. Other options are very familiar to you. Okay, we have next question. A patient comes to the clinic and says, I have caries. On examination, patient they found an anomaly in the above episodes. Okay, so this is a way of recollecting this. Students has recollected this question. Anyway, we are concerned about the radiograph. Okay, what type of anomaly is seen in this radiograph? Identify the structure. Okay, what is the anomaly here? Okay, you can see that in the radiograph you should appreciate the central incisor here. There is one central incisor here, the other central incisor here. In between the two central incisor, we are seeing a tooth-like structure. We are taking a tooth-like structure which is seen between the roots of a central incisor. So that is a supernumerary teeth. Okay, so A can be the answer. It is a supernumerary teeth. And best answer, the best answer, the real name of this, it is the supernumerary teeth which is coming in between the roots of the central incisor, that is the mesiodens. So go for mesiodens. The condition you are seeing here is mesiodens. Yes, it is a supernumerary teeth. Option A. If you ask me, sir, option A can also be the answer. Yeah, it's a supernumerary teeth. Supernumerary teeth can be mesiodens, it can be distodens, it can be paramolars, distomolars. Okay, peridens means that supernumerary coming in any part of the arch. Okay, anywhere. Okay, so this can be anything. But the best answer, you have to select the best answer from the option. Best possible answer. That is mesiodens. Okay, so I hope this is clear. Okay, this is one another. This is a very frequently asked IBQ, image-based question. I think you are familiar with this. The yellowish spots denoted in this picture. Now, in this picture, you can see the buccal mucosa in the oral cavity. You can see. Okay, to identify the buccal mucosa. On the buccal mucosa, you can see certain yellow spots. Right. What are these yellow spots? What are these yellow spots is what they are asking. So these yellow spots are nothing but your Fordyce's granules. Fordyce's granules. Now, what is this Fordyce's granules? This is a developmental anomaly. That is a developmental anomaly. Now, how can you say it's a developmental anomaly, and what is it actually? You know, on the skin, okay, you have skin on your body, right? You have skin. On the skin, you have hair follicles. Hair follicles are seen on the skin. And what keeps the skin moisty, waxy? You have sebaceous glands. Sebaceous glands are seen over your skin. Now, listen carefully. Sebaceous glands are not usually present inside your oral cavity. Sebaceous glands is an ectodermal component that is seen in the skin. Now, if by the defective development or as a developmental anomaly, if the sebaceous gland is seen in the oral mucosa, it comes in the oral mucosa. Okay, so the presence of the sebaceous gland, which is naturally seen in the skin, but now ectopically it is seen in the oral mucosa. So that is ectopic presentation. The ectopic presentation of sebaceous glands in the oral mucosa, that is called a Fordyce's granules, and it is called a choristoma. You may have heard about hamartoma, teratoma, choristoma. Okay, hamartoma is the normal growth of the structure which is native to that area. Okay, but choristoma is the growth of a substance or growth of a cell or a tissue which is not native to that area. Sebaceous gland is on the skin. Okay, not native to oral mucosa. So, but the sebaceous glands, when they grow or when they is present in the oral mucosa like this, the mucosal membrane like this, okay, it is ectopic. It is not supposed to belong there, right? This condition is a choristoma. This condition is called fordyces granules. Okay, so this is what you see, and it's called fordyces granules. Becomes striae seen in lichen planus. We will see in lichen planus. It's not herpes simplex or any other ulcers or something. The condition is clear. Image is clear. Okay. Let's see this question. A 50-year-old female reports to the OPD with a complaint of burning sensation of tongue. Okay, she is having burning sensation of tongue, and on examination there is presence of multiple demarcated zones of erythema surrounded by white border, and that is frequently changing the location on the tongue. Okay, so the one thing is usually this clinical questions they ask you, and what is they mentioning about? Just read the question. Old age female. I always tell the students to read word by word, line by line. Okay, old age student have burning sensation. I have symptomatic, sometimes symptomatic. A few months it is reported in few months, and there is multiple well demarcated zones of erythema. Okay, erythematous zone is there, white border is there, frequently changing the location means it is migrating. Okay, migrating. So what they are talking about it, they are talking about a migratory glossitis. Migratory glossitis. They are talking about migratory glossitis. So from the options, it is very clear they are talking about geographic tongue. Geographic tongue is the answer. It is usually asymptomatic, but it can come symptomatic in some cases. No issues in that. But major component you should stress here, they is surrounded by erythema, by a white border, and the migrating nature. They are talking about geographic tongue. Okay, hope it is clear. Median rheumatoid glossitis, I have told you, it is diamond shaped or a rhombus shaped in the center, in the median, and it is now considered a fungal infection. Previously it was a developmental anomaly. Okay, so that is one thing. Okay, we have again this question, and this is the same question, that's a repetition. It is mesodense. Okay, that we have already discussed. Yeah, coming to this question. See, a patient reported with history of multiple bony fractures and following clinical condition. Okay, see how interestingly they have formulated a question. This is an INI-CET question. A patient is reported with multiple bony fractures. So the defect is with the bone actually. Okay, and there is a similar dental condition. So multiple bony fractures, by what they mean is that there is some defect with the bones. They are pointing towards osteogenesis imperfecta. So osteogenesis imperfecta is the what they are talking about. Osteogenesis imperfecta has no relation with the dendrogenesis imperfecta. That is true. But in osteogenesis imperfecta, you will see the dental findings very similar to dendrogenesis imperfecta. Okay, please feed in your mind. Please listen carefully. Osteogenesis imperfecta is not related to dendrogenesis imperfecta. Okay, osteogenesis imperfecta is not related to dendrogenesis imperfecta, but the condition, the dental finding, the oral finding in osteogenesis imperfecta, the person who is suffering from osteogenesis imperfecta has an oral finding that is very similar to that of a dendrogenesis imperfecta. Okay, means they will also have this opalescent teeth. Okay, they will also have this brownish teeth. Okay, so all this will be there. So that's what they have shown here. The tooth are brown. Okay, tooth are brown and all. And what is the gene mutated here? Mutation. Okay, in both in osteogenesis imperfecta and dendrogenesis imperfecta, the gene mutation is the COL1A1. The answer is COL1A1. So other options, how to prepare. Okay, how you should prepare for your NEET INICT. You should not go just answering it. You should see the other options also. There is other 3 questions in this. Okay, one MCQ has 4 questions. One with that MCQ and the other 3 options. What are the other 3 options? Okay, what is APC tumor mutation, adenomatosis polyposis coli, which tumor, which syndrome, okay, has this APC? Go back, revise. AMELX gene, okay, AMELX gene, amelogenesis imperfecta, X-linked. It's an X-linked amelogenesis imperfecta. Okay, that's thing. GNAS1, GNAS1, which one? Fibrous dysplasia. Okay, so this is how you should prepare. Okay, I hope it is clear. And this is a chart which I have made for you. Okay, so this is table I have made it for you to have a quick revision. Okay, so you can take a screenshot or you can use this for a your quick revision. Okay, I have compiled everything for you. Okay, the condition, how to identify clinically, how to identify radiographically, and how to identify histologically, and the part about the pulp. This chart, I have made it for you. Okay, you can have a screenshot of this. So that's the revision. Okay, I hope you are clear with the developmental anomalies of your oral cavity. It's a very simple and very scoring chapter actually. Okay, so see you in the next video with the next topic. Thank you. Bye.